Hello everyone, my name is Desiree and I'm a physiotherapist at Xcel Health. In the previous video, we discussed as to what a wrist sprain is, the mechanism of injury, the common symptoms, and how it can be diagnosed. In this video, I'll be discussing a few treatment protocol as to how to go about if you experience with a wrist sprain. So after you're diagnosed with a wrist sprain, the immediate thing that you can do is to follow the RICE protocol. Now, the RICE protocol means rest, ice, compress, and elevate. Rest your wrist as much as possible. Ice your wrist area in and out, and you can elevate the wrist by placing it on a towel or a pillow whenever you're probably watching a TV or doing nothing and just you're into your leisure activity. Just place it elevated with an ice pack on it. And the next thing would be to compress it. You can use a wristband or a crepe bandage to calm the swelling in the wrist area down. After you're done with this, you can start with a bit of stretching exercises to do. Now, the stretching exercises can be done in two ways. Only if the pain can be maintained and the swelling is a bit lower than the initial few days. So after a day or two, start with gentle stretches. Now, how do you go about with the stretch? I'll slowly tilt myself towards the sides. All you have to do is place your hand forward and gently take the wrist inwards and hold this position for 15 seconds. And you can push your wrist area, your fingers inwards, only as much as it's comfortable for you. After 15 seconds, let it come back to its original position. The other stretch would be to bring your fingers outwards. Hold this position again for 15 seconds and bring it back to its actual position. So these are the two stretches that you can start with. You can do it twice a day with 15 seconds of hold. And the next thing would be, if you could manage grabbing a pillow, a ball, or a roll of a towel just like this and squeeze it for 10 times. So what this will do is add a bit of movement around the muscles in this area, and that movement will ease the swelling off and also promote a bit of strengthening around the wrist and the hand area. So just compress, hold it for 5 seconds, 1, 2, 3, 4, 5, and relax. This is the second exercise. Along with this, in case a health practitioner has prescribed you with pain medication, you can go ahead with it only if it's prescribed. And after a week, when the pain swelling subsides, you can start with the strengthening of your wrist. Now, how do we go about with strengthening? Imagine this is probably half a liter of water bottle. So imagine this is the surface you've placed your wrist onto, and just try to take your wrist in and back to its normal position, inwards and back to its normal position. The same thing you can do by turning your wrist and pulling it upwards. Yeah. So you can repeat these two exercises 10 times again, twice a day. And the next exercise would be to gently roll your wrist clockwise and anti-clockwise. Clockwise and anti-clockwise. These are certain exercises that can help reduce the swelling, pain, inflammation, but do not forget to ice your wrist after every exercises, because icing calms the ligaments that are inflamed and irritated. Hope this video helps. Bye-bye, stay healthy and take care.